All right, well, so we'll get started. Sorry for being a couple minutes late. Thank God we have staff like Megan who ensures that we're on time, so thank you for that. Welcome, everyone. This is a really exciting day for us here in Wichita. We are joined by representatives of the Kansas Health Science Center, Kansas College for Osteopathic Medicine, or CANCOM. I joked with the staff that we're calling it CANCOM, C-O-M, because you guys don't have faith that I can say osteopathic, but apparently it's the real branding of it, so I don't feel bad using that terminology. So we thank them for taking the time out from their busy schedule to be here with us and to share some really exciting news, not only for CANCOM or KansasCom, but for Wichita and our entire region and state. Today we're here from Dr. Tiffany Masson, president of CANCOM. We're also here from Suda Tokla, Ms. Suda Tokla, who is with the Douglas Market Development. We're also here from Jeff Fleur, who was with the Greater Wichita Partnership, and our very own Scott Rigby, who did get the text message today. Scott, we're wearing bright blue suits today. Glad you got that, and we're matching. So today's announcement represents not only the hard work really of these individuals and those who came together to help create this exciting new venture that truly couldn't come at a better time. So without further ado, I will relinquish the floor to Dr. Masson to tell us more. Oh, also, we have Councilmember Johnson here with us, so should probably introduce him. Sorry. Should have done that in the beginning.
Well, thank you so much, Mayor Whipple. I'm just truly thankful for all of your support. So it is an honor to be here today and to share news that holds great promise, not only for the proposed Kansas Health Science Center, Kansas College of Osteopathic Medicine, but for the city of Wichita and the greater state of Kansas. I am pleased to announce that our proposed Kansas College of Osteopathic Medicine, or KansasCom, as we call it, has officially received candidate status, approval from the Commission on Osteopathic College Accreditation, the recognized accrediting agency for the approval of colleges and programs leading to the Doctor of Osteopathic Medicine, or DO degree. So for us, this is a significant achievement and a critical milestone in our journey. So the next step. We plan to apply for pre-accreditation status, which means we are one step closer to our goal of building the first osteopathic medical school for the great state of Kansas. And achieving candidate status specifically means that we have engaged in the effective planning and the necessary resources for this stage in our process. It is a testament to the dedication, creativity, and persistence of our incredible leadership team. And I also want to emphasize the importance of the steadfast support that we have received from the Wichita community, to which I am forever grateful, and to the healthcare providers throughout the state and the region. We have worked in partnership to assess the healthcare needs in Kansas, and we are in the process of building a strong program that will prepare the new generation of committed, compassionate, and highly skilled osteopathic physicians to meet those needs. And our plans are both ambitious but yet doable. So specifically, we will continue to work with our partners to remedy what is a significant problem for our state. The Kansas is dramatically underserved by physicians and ranks 40th in the nation in terms of physicians per capita. We anticipate that by 2030, we will have an even more significant shortage of physicians, and we are committed to rising to this challenge and being part of the solution with so many of you. I want to especially thank the Riverside Health Foundation for their generous gift of $15 million and for their long-standing commitment to the education of osteopathic medicine. I also want to thank the Wichita community, city officials, the Greater Wichita Partnership, Downtown Wichita, the Wichita Chamber of Commerce, and so many others, and numerous healthcare partners for their continued and unwavering support. And a very special thank you to TCS Education System and the Chicago School of Professional Psychology for their tremendous support. So, what do we have to look forward to? We envision the proposed KHSC Kansas COM will be a forward-thinking osteopathic medical school with a groundbreaking training program that will anchor the Kansas Health Science Center, pave the way for new avenues of healthcare preparation in the future, and serve as a medical education technology hub for the region. In addition to housing our new proposed KHSC Kansas COM, we are also in the process of transforming this historic 90-year-old corner of the city, which once was home, for all of us that know, Macy's and the Innis department stores in our old state building. So this is exciting new space, and it will be a critical part of the much larger project to revitalize downtown Wichita. So the campus itself will be state-of-the-art. It will include an osteopathic skills training center, which is core to who we are. It will include standardized patient teaching rooms, a simulation center, large lecture halls, numerous small group study rooms, a research center, and a virtual anatomy lab, and much more. So we are in the midst of creating a curriculum that will be innovative, patient-focused, and community-based. And we will be recruiting approximately 40 faculty and staff over the next 7 months, with a goal of hiring more than 100 individuals across the next 3 years. But even as we are committed to creating effective spaces and a top-of-class curriculum and to hiring exceptional people that fit within our culture and our values, we are committed to honoring the history of our exterior space, making it central to who we are and our values. It is therefore fitting that the park, which honors the significant role that Chester I. Lewis played in the civil rights movement, serve as the front entrance to our campus. Chester Lewis is an awe-inspiring part of Wichita's history. We believe that connecting his storied history to the proposed KHSC Kansas COM is an incredible gift. And we plan to honor him and that history by creating a space to educate future potential students, faculty, staff, and visitors about the Dockham Sit-In and the courageous actions of those students led by Chester Lewis almost 62 years ago. So we're eager to work with the city. We're eager to work with the Lewis family and the community in designing an enhanced park design. I am proud of the progress that we have made, and I know we are well positioned to build an innovative osteopathic medical school that will positively impact the healthcare landscape in Kansas and beyond. Again, the team at KHSC is deeply committed to increasing accessibility to healthcare and enhancing the practice of medical education through technological innovation. So as the pandemic has made ever so clear for many of us, all of us are indebted to those physicians and healthcare workers who every day demonstrate courage, resilience, compassion, and who serve as an example of the character we envision for our future healthcare leaders of tomorrow. So again, let me thank them and all of you who are joining us here today and virtually, and thank you to Mayor Whipple. I'll pass it back to you. Thank you so much.
Thank you, Doctor. This is truly exciting news. We're next going to call up Ms. Suda.
I just want to say that I'm super excited for Kansas Health Science Center, which is a freestanding, nonprofit, spanking new university that's going to go into downtown university, and for the great achievement of achieving candidate status. Achieving candidate status has many standards that the school, that Kansas Health Science Center had to meet, but the two main ones were achieving financially. They had to achieve, they had to achieve at least $75 million or over that. And the second standard was having community support. And I'm really excited with the community support that we've gotten from Mayor Whipple, Mayor Jeff Longwell, Scott Rigby, who 3 years ago when I sat with him must have thought this was crazy. But I'm just sincerely want to thank Dr. Tiffany Masson and Dr. Joel Dickerman, who's the dean of the school. They have tirelessly for the last year traveled to all corners of Kansas to get the community support, the physician support that was required to achieve this step. And I think going forward, it'll be extraordinary amount of hard work that Dr. Masson and Dr. Joel Dickerman will be doing for Wichita, that they're calling home now. For me, Wichita has been a home for 20 years. For Tiffany and for Joel, it's been a year to 2 years. But the amount of hard work that they're doing to achieve this for Wichita and for Kansas on the whole is very admirable. Thank you.
Thank you. Next person we will hear from is our Assistant City Manager, Mr. Rigby.
Thanks, Mayor. So excited to be here. Suda, I think I was not surprised, but pleasantly excited that you had a commitment to bring higher education to the downtown. In my previous cities, I've seen the impact educational institutions have on downtowns and cities, and are excited to have this opportunity to bring new educational institutions into the downtown. As we know, as universities, it's not just about the students that they create, but the faculty that work in our communities, that do consulting work, that spew out research dollars. So if you look across the country and look at universities and see what they do for downtowns, it's just tremendous. And as a city of Wichita, and talking with Mayor Whipple and previously Mayor Longwell, they understood that as much as we focus on many industries in our community, specifically aerospace, and want to be a center of excellence for aerospace, we have a goal of becoming a center of excellence for healthcare and medical tourism and education. And we know as we do that, not only will it help our existing residents and citizens, but our businesses. And then this ripples not just through Wichita, but through all of Kansas. As we know with COVID, and even before COVID, there are many sections of rural Kansas that lack healthcare and practitioners. And so our goal with this and with our partnership with President Masson and the school is how do we help not just Wichita, but Kansas continue to be healthy, strong, not just as residents, but business focused. So this project is a culmination of several years of work. Our excitement, I know Jeff Floor with the partnership will talk about it briefly as well, but this is more than just the single former state office building. This kicks off not only a park renovation, but it'll bring student housing into the adjacent old Sutton building, as well as reutilize the Broadway Plaza building into a future hotel, as well as a future opportunity for culinary and hospitality school at the former Henry's building. So all combined, this project, not just the DO school, but the entire project is about 500,000 square feet. And that over the 20 years, Wichita State University did a cost benefit analysis, will produce over $1 billion worth of payroll, of net new payroll into Wichita. And that's tremendous. And more than 800 net new jobs for the community over that 20-year process. But even better is, as we look at this, is the amount of new research and technology that will come into our community, because we know that will attract other businesses and other individuals who may not have thought about Wichita or Kansas previously, but will now look at Wichita as a place that they need to do business. So again, we're so excited to be part of this effort. We know it's a tremendous step. We look forward to working with President Masson, and we look forward to continue to work with Suda and her effort. And I think as the media talked about, as a father of 4 daughters, it's so cool to see the president of the new medical school and the president of the development group be female, and to be great role models for our community. So with that, Mayor, I'll turn it back over to you.
Thank you, Mr. Rigby. Next, we'll hear from the Greater Wichita Partnership. Ms. Floor is with us.
Mayor, thank you for this morning and this opportunity, and to you, Suda, for your vision and tenacity to assemble 5 buildings in our downtown area so that we could have this type of opportunity with Dr. Masson. So thank you to you both for what you've done already today, but I know even more so what you're going to be doing in the future. This announcement is really a trifecta for economic development. This mask keeps me, I'm smiling right now, just so you know, but it really is a tremendous moment for our community. If you think about how this project will further critical strategies in Project Downtown in relation to education, and how it will help other markets actually in the downtown area. Looking at our regional growth plan, healthcare is a target sector industry that we understand there are opportunities, not only today, but the future. This will help us be able to realize a lot of those opportunities currently, but also cultivate new ones as we go forward. If you think about the future development of downtown, it will also help us, if you will, cultivate new development projects that will further the vibrancy and the importance of this economic center, not only for Wichita, but for the 10-county region. And lastly, when you look at talent, it's a world-class facility that we will have as a medical school in our downtown that will help us retain talent. We've talked about on numerous occasions how it is we lose talent. This will help us retain talent, but also bring new talent into our marketplace as well. So 3 key areas that will be really impacted as we go forward with this project. The other thought I want to leave with you today is that if you reflect upon the last 10 years with Project Downtown, which is the strategy that we're following to develop this urban center. If you look at the scope of that area from Washington Street into the Delano area, thinking of Douglas, just that corridor alone, this project now kicks us well beyond $500 million of investment along Douglas Avenue alone, that one corridor. So it's really paving the way for us to be that world-class city. So again, to Suda, Dr. Masson, Mayor, Scott, and others, thank you for this partnership that is on demonstration today, because it truly is our future. So thank you again, Mayor, for this opportunity.
So thank you, Jeff, and thank you for all the hard work everyone has done on this project. Today's announcement comes at a time when we need medical professionals, and that is starkly apparent. Dr. Mason said, the need for physicians is great, not just in Kansas, but across the nation. Before COVID-19, the Federal Health Resources and Service Administration estimated that the United States had a shortage of around 20,000 physicians, particularly in rural and underserved urban areas. And this project, this is projecting to get worse in the coming decades. Staffing shortages at hospitals during the pandemic have drastically highlighted the need for more doctors and more medical professionals. The new DA school will allow us to help fill that need. We couldn't have gotten here without the vision and hard work of Suda and her team, or the hard work of Dr. Mason and the individuals at Kansas Com. This school will drastically shape our downtown area and help us attract and retain new talent in our community, as was mentioned by Mr. Freer. Thanks to this development, we will be able to revitalize the historic Chester Lewis Reflection Park and infill underutilized buildings in our core of our downtown. And as Scott highlighted, the school brings with it additional jobs and the addition of students downtown that will also bring more activity to area restaurants, retail, and more. In a year full of setbacks and challenges for all of us, this announcement is an assurance that our future continues to be bright. And with that, we'll stand for questions.
For representatives of the health center, what can a resident of the area expect if they're not familiar with osteopathic medicine? Short answer, because I'm not allowed to. What can they expect in that regard?
If you guys want to step up to the podium, you can answer.
Can you say your question again? I'm so
Yeah,
sorry.
for a resident that's not familiar with osteopathic medicine, what can they expect for this center? What can they get out of it?
Right.
Yeah, so the question was, as a resident of Kansas and Wichita, what could a resident expect to get out of a DO school? And I think what's important to know is that DO education and medical education, it leads to the same licensure as allopathic medicine or MDs. But it does have a different type of training, which incorporates osteopathic principles and medicine and manipulative medicine. And so we look forward to bringing that part of medical education to our community. And also, I'm extremely passionate about how we can build in and infuse technological innovation into enhancing medical education, and how we can do that to really enhance student learning so that we're preparing the best physicians for graduation and ultimately to practice in our state and beyond. So I'm really excited about what we're doing, the innovation that we're bringing, the team with Dr. Joel Dickerman as our dean and leading the curriculum. They're doing an amazing job and really thinking outside of the box, but yet within the parameters of what we know we need to teach our students related to medical education so that they can ultimately get licensed and practice.
That our students locally can look forward to going to that school.
Yes, of course. So one of the questions here was, could potentially students in the state of Kansas and Wichita join such a DO school? We can't recruit students until we move into the third phase of accreditation, which is the pre-accreditation phase. But once we're through and past that phase in time, we can then ultimately start to recruit students. And so we'll keep all of you abreast of that progress as we move into submitting our third phase of accreditation.
Further questions? Very good. Thank you all for being here, of course. And this is a huge opportunity for our state and our city. So if there are questions that come up, please reach out and we'll be happy to take those questions at the city or direct you towards one of the professional groups that are also helping make this possible. So thank you all.